for them to realize that they're there not to serve themselves, but they're there to serve, their patient. And third, I believe is important to provide respectful care to the patient by using the golden rule, right?
The idea of patient-centered care is not new. It's a term that we hear thrown around a lot in healthcare. As the famous Sir William Osler once said, it is much more important to know what sort of a patient has a disease than what sort of a disease a patient has. When it comes to echocardiography, patients are typically stressed and worried about the results of the scan. So how can we provide them with better patient-centered care? Here to help us answer that question is Jesus Sanchez. Jesus is the Diagnostic Operations Manager for UNC Health in North Carolina. Prior to this role, he was with Memorial Healthcare System in South Florida as their echocardiography manager. He has more than 10 years of experience in the field, and he is also currently an adjunct instructor in echocardiography for the Cambridge College of Healthcare and Technology. Thank you for being here, Jesus.
Thank you, Emmanuel. It's a pleasure to be with you.
So I don't think any practitioners need to be convinced that providing patient-centered care is important and something worth striving towards. However, for those who are not echocardiographers, especially even for patients, maybe that moment of receiving the scan doesn't seem to be the most significant opportunity to provide patient-centered care, but it is. These types of scans many times are worrisome for the patient. They could easily be stressed over the results. Like we said, they're already walking in with stress, whatever it may be. So as a practitioner, what do you believe are the key elements in providing empathetic and respectful patient care as an echocardiographer?
Well, I believe that it is important as an echocardiographer to primarily value the patient. It is important to realize that this is a human being that you are taking care of, and they are worthy of respect and of honor. So we must value the patient first. That's the key part. We must teach our staff that they are there to provide that patient care, to that individual because they deserve that honor and respect. So that's number one. Number two, I think it's important for our staff to come into work with the right attitude, for them to realize that they're there not to serve themselves, but they're there to serve, their patient. And third, I believe is important to provide respectful care to the patient by using the golden rule, right? Put yourself in the shoes of the patient. If you were the patient, how would you like to be treated? So this is something that I teach all my staff to value the patient, respect the patient, and treat the patient as they themselves would like to be treated.
So important. I mean, really, the golden rule is a great measure for clinicians, right? Because it could be easy, especially after a long taxing day. Let's say you did a bunch of scans. By the time the next patient comes in, I mean, we're all human. It could be hard to want to maintain that same standard, but so important to go back to the principle of the fact that we are all human. We could be the patient. So it's something to keep in mind. Now, communication is key, right? I mean, it's easy for the patient to go into the room and, be nervous. They don't know how things are going to go. Maybe they've never had this sort of scan. Maybe they've had too many scans at this point, unfortunately, because of their condition. And having an echocardiographer, sonographer that isn't communicating well just isn't the recipe for patient-centered care. So could you share some effective communication strategies that you've used, that you've taught in for the purpose of helping patients feel more at ease during the scanning to really get over that hump of the nerves and just of the stress of the situation?
Sure. So I was fortunate to start off my career in a really great healthcare system, the Memorial Healthcare System. And when I was there, they taught me a technique. It is called AIDIT. And I teach this now to my own staff. AIDIT stands for A for acknowledge, I for introduce, D for duration, E for explain, and T for thank you. So that's one technique that I teach my staff. And just to give you a quick little example, piggybacking from what I mentioned before, we want to value the patient and we want to ask, if I was a patient, what sort of questions would I have? So if you come in to see me, I would like to know who you are, why you are there, what are you
Mm,
going to do to me, and how you're going to do
mhm,
it. And I believe
mm,
AIDED answers these questions. For example, A, acknowledge. I will come into the room and I will say, Mr. Soto, my name is Jesus Sanchez. So I will introduce myself. D for duration. I will be doing an echocardiogram, also known as an ultrasound of the heart, and the exam will take about 45 minutes. And then E
mm,
for explain. Throughout the exam, I'll be using a transducer or an ultrasound probe to get images of your heart from different areas around your chest. I'll be applying some mild pressure. Please let me know if it's too hard for you and I will adjust. And then T for thank you. When you're done with the exam, you want to thank the patient for choosing your healthcare system. There's many healthcare systems out there,
yeah.
and patients, they can now go to wherever they feel they are valued the most. So I believe aided is really important. There's another thing that I teach my staff, and it's called a heart head heart model of communication.
Mm,
So say a patient is angry, upset, they feel a certain type of way, they don't feel very good, which is understandable, right? The patient
yeah.
is coming into the hospital or to the clinic, they're not feeling their very best. And we want to answer these patients in a right way. So we want to start off with a heart comment. So say they're upset that their exam has taken too long. So you want to respond and you want to say, Mr. Soto, I am so sorry that it has taken a long time to get here. And then use a head. So you're resolving the problem and you say, but here I am now and I want to take care of you and I want to do the best job possible. And then you end with another heart comment, such as, it's been a pleasure taking care of you. I reassure you that we have done an excellent exam for you today. So those are two techniques that I use. And there's one other thing that I believe is very valuable when we're imaging patients, and it's not necessarily related to communication, but it helps. And that's the idea of keeping the patient comfortable throughout the exam. I've noticed that some sonographers, they rush into the exam and they don't take
Mm,
time to make their patient comfortable. For those in the audience that don't know the positioning of the patient, we turn the patient into a left lateral decubitus position. So we're turning them on their left side. And some of our elderly patients have a hard time balancing their body
right.
because they don't have that support. So I always
Mhm,
tell my staff to use an echo wedge if possible,
mm,
pillows behind the back, pillows in between the knees, pillows to support the neck. And the idea is that if you make your patient comfortable, the more comfortable that they are, the better exam that you will have, the better images that you will have, and the better experience the patient will have. And believe me, they will remember these things. They will look, wow, this sonographer has taken the time not only to communicate well with me, but also to make me feel comfortable throughout the exam.
exactly. I mean, those are instances that remain in the patient's mind for sure. I mean, I'm sure we can all think of a clinician who did a great job in a moment where we really were in not the best state, and we remember that, right? We remember the people who have an impact. So just small things like what you said, positioning, things like just having human communication too, right? Interactions, really having the heart, like you said, can go such a long way because sometimes, especially in hospitals, some hospitals, of course, have better training than others for their staff. It's true, but in general, the patient, it's not really the environment you want to be in. That's the truth for as the patient. So that human component is so important to not feel like you're just being taken through a system, a cold and calculated system. People are frustrated over the scheduling. Oh, over the time it took for me to see someone. Sometimes, of course, as a patient, you don't understand that there's a lot going on right behind that system that you think is just bureaucratic. But to the patient, I mean, they're very focused on their situation. So all that advice you gave is just so good. So as the rapport is being built, I feel too that there's a certain trust that should be the product of healthy communication, right, between the clinician and the patient. And trust, of course, is really important in healthcare. Like you said, there's a lot of healthcare systems. They don't have to usually, especially in big metropolitan areas, they're probably not confined to one clinic, one hospital. And patients want to feel that they can trust not only the physician, the referring physician, but also all of the other practitioners they're going to encounter through the continuum of care. That being said, in your experience, what role does patient-centered care play in building trust between the patient and the echocardiographer? And could you give us some examples of that?
Yeah, my pleasure. I believe patient-centered care is of utmost importance in any healthcare institution. As you mentioned, there's competition here in North Carolina, where I live now. We have UNC Health, where I work. We have
Mm,
Duke University, Duke Health. We have Wake Med, and there's just tons of competition here in the
right.
area that I work at. So one example that I can think of is the care that we provide for our cardio oncology patients. These are patients that are coming in to have an echocardiogram before their chemo treatment, during their
Mm,
chemo treatment, and post chemo treatment. And the idea is to get a baseline of the heart, to understand what does the heart look like, how does it function before chemotherapy has begun, and then monitor that heart function and see if maybe the chemotherapy has damaged the heart. So
mm,
with these patients, what I have noticed as a manager is that when my staff delivers that excellent patient-centered care that we're talking about, these patients will call before they schedule their appointment. This has happened many times to me. They'll call before their appointment and they'll say, "Hey, Jesus, can I please, before I schedule my appointment, can I please make sure that this specific sonographer is there?
mm.
Because I would like for
Wow.
them to
Wow.
take care of me again." And I see this all the time. These patients come in at first for their pre-chemo echo. They get one sonographer. They're treated awesomely, the best.
Wow.
They get that amazing patient care that we're speaking of, and they love it so much that they want that same person taking care of them because they realize that this is just great care that they're not going to
Yeah.
find anywhere. So that's one example that I can think of. Patients returning back to us and wanting to be cared by specific sonographers that are delivering that excellent patient care.
Yeah, I mean, there's no better evidence than that, right? For them to call back and ask, hey, can I see the same person? I mean, that already, shows that there's trust that's been built. So it definitely, it's more evidence to show that the more patient-centered the care is, the better the communication, the more trust there's going to be. That's wonderful. Well, we mentioned this in the beginning, but like you just said, you're the Diagnostic Operations Manager at UNC Health, and before that, you were the Echocardiography Manager at Memorial Healthcare. So you have plenty of experience training and teaching sonographers in a variety of skills, and one of those areas I'm certain is providing good patient care. You already told us about a few of those tactics that you use with your team. Now, as a manager, for those who are watching this that are managers as well, how do you approach training team members in providing better patient care, especially if they're new or if you know that they come from a setting or facility that doesn't have the same training standards, doesn't have the same philosophy, perhaps, because different places operate differently. That's the truth. How do you handle that as a manager?
And that is a difficult question, but I'll do my best to answer. In my opinion, I believe it happens even before you have hired them. I believe this occurs even in the hiring process. So when you're hiring, you want to rule out those people that want the job for the wrong reasons. So you want to
Mm,
hire right. So you want to ask these historical questions to the candidate. You want to ask them how they have handled patient care in the past. You want to ask them to give you some experiences, some examples of how they've gone above and beyond to take care, of
right.
patients or whatever it is that they did in their previous job. So that's number one. You want to try to hire the right person, and that's difficult.
Mm,
It requires a lot of insight, a lot of discernment, and you have to ask these pointed questions. But once you have hired the person, then you want them to be on board with the mission statement of the Echo Lab. So in the
mm,
Echo Lab that I work at, our mission statement is to provide the best possible care for the patient, best possible care. So
mm,
whatever is in the realm of possibility that we can work on to give that patient care we want to do. So
right.
once we hire them, they're on board with the mission. Then we start with some communication tactics, as I mentioned, aided. So we have
Mm,
an aided form that we review with them. Is an annual competency that can be done. You want to make sure that the staff member understands what it means and that they're using it on a daily basis. And another component that I believe is very, very key is emotional intelligence, which is, in my
mm,
opinion, not spoken of enough in the
yeah,
healthcare field. So I train my staff and I encourage my staff to take courses on emotional intelligence so that they can learn to deal with their own emotions, recognize
right.
when they're angry, upset, so that they don't respond in a harsh way to the patient. We want to respond, you know, um, with sweet words to the patient. The
Yeah.
Bible says that sweet words bring healing to the bones. So
Mm,
we want our staff members to be speaking in a gracious, polite,
yeah.
and respectful manner. So emotional intelligence is very, very key. And the last thing is effective communication skills, and that's some other courses that I enroll my staff in.
That's great. I mean, the part where you talked about emotional intelligence really resonated because we, not that long ago, had another imaging manager on ultrasound today, or on the scoop of ultrasound on ultrasound. His name is Tristan Thompson, and he spoke of overcoming challenges as sonographers. And one part of that, he talked about the importance of, taking a step back in stressful situations and trying to understand the patient more, what the patient's going through, not to take things personally was a big thing that he said. And I think that plays a lot into the component of emotional intelligence, right? Being able to regulate, to understand, okay, like this isn't a personal attack. If a patient's agitated, probably isn't. And I'm really understanding how to be able to respond well and in a nice way regardless of the situation. That's really great. Now, I'm sure viewers would be interested in hearing firsthand accounts of the power of patient-centered care in Echo. I know you mentioned the example of the patients, the oncology patients, and do you have any other memorable instances where you witnessed the positive impact of an empathetic patient interaction?
Yeah, well, I would like to say that first and foremost, I see this all the time. When my staff takes care of the patient and they focus on their needs and they value them and they go above and beyond, the patient leaves with a smile, they're grateful, and they keep coming back. But to give you one example, and this happened long ago, earlier in my career, um, as I was being strengthened and as I was learning to go above and beyond, there was this elderly couple. There was this elderly man in a wheelchair with his wife. She was also in her elderly years, and they came in for an echocardiogram for the husband. So I brought them in. I did his ultrasound. And after I was finished, I was walking them out to the waiting area. And in my mind, I was thinking, how is this old elderly lady gonna get this man into the car? And I could
Right.
tell she was, you could tell she wasn't very strong, and you can tell that
Mm,
she she would be grateful to have some help. So I told her, ma'am, may I please help you get, this man into the car? And she's like, sure. So I walked out with them to the main
Mm.
entrance. I waited for her to bring the vehicle around, and I helped the man into the vehicle, and they were so grateful. They gave me a hug and a kiss, and they
Mm.
thanked me. And believe me, I've done this many, many times, and I encourage my staff to do the same thing. We are taking care of someone's mom, someone's father,
Mm.
someone's grandfather, someone's son, someone's aunt and
Yeah.
uncle. So we really, really want to go above and beyond. It's not just performing the echocardiogram, but it's
Mm.
also taking care of these people as as if we truly care for them, So we want to be
Yeah.
compassionate, and we want to be loving, we want to be graceful, we want to be merciful. And as you mentioned, we don't want to be upset if they respond harshly to us. These are people that are hurting, they're
Yeah.
sick.
Yeah.
This is not their best day. So
No.
taking it personal would
Mm.
be very unwise, in my opinion.
Yeah. Yeah. No, I mean, such great advice, such a great example, very encouraging to hear. And I really hope that your story serves as encouragement too, to other echocardiographers out there, other clinicians working in hard environments, which hospitals are, clinics are. I mean, the nature of the field is difficult. But when you hear stories like that and you see how patients appreciate it, I think it just kind of brings you back to the why of why you're doing it, and the mission behind it, keeping that at the forefront is just so important. Well, this has been a really valuable conversation. I hope that, like I said, serves as encouragement, inspires other echocardiographers. I think your career already serves as inspiration enough, and that inspires other managers too to be able to adopt the principles that you spoke of, and if they already are adopting them, to continue doing it and pushing past the difficulties of the job, because management is definitely not easy. So thank you again, Jesus.
My pleasure, Emmanuel. It's an honor to be with you, and it's a privilege to be able to manage staff, and it's a privilege to encourage and uplift my team members to provide that excellent patient care that we're speaking of.